Okay, this is part 3 of Dr. John Mcdougall, the doctor who fought for you, from this book by me, Pete Rogers. So this is what Dr. Mcdougall wrote about diabetes. We just finished up the last lecture, part 2, where he said it is important for patients to realize that fat causes diabetes. How can a patient get better if they don't know that? If they don't know that, then they don't know what to do. So what you should do is minimize dietary fat. Okay, Mcdougall continues. Sugar does not cause diabetes. Sugar makes diabetes better. Reference, New England Journal of Medicine, 1971. When for 10 days, patients were fed a diet of 85% carbohydrate, like the Mcdougall diet, instead of 45% carbohydrate, like a Western diet, the fasting blood sugar fell. Oral glucose tolerance test improved and fasting insulin was decreased. These data suggest that a high-carb diet increases insulin sensitivity. Okay? Here's another paper by David Jenkins about type 2 diabetes and the vegetarian diet. Patients on a vegetarian diet improved blood sugars in diabetics, with 39% stopping insulin within 3 weeks of therapy and 71% stopping all their diabetic pills after 3 weeks of therapy. It's routine that type 2 diabetics routinely come off their meds, often completely, and get better when they eat a low-fat vegan diet. The sooner they start doing that, the better. Also, if they lose weight. Roy Taylor had shown if they lose 30 or more pounds, 100% of his patients got better that had had type 2 diabetes less than 4 years. Okay, continuing. Others have also reversed retinopathy with a low-fat diet. Here's the papers. Okay, let me shift this over a little bit. The best diet for diabetics is a low-fat, starch-based vegan diet with no oils. Basically, the Mcdougall diet, the Esselstyn diet, the Spartan vegan diet of mine. Okay, why manage? Now, here's a great point by Mcdougall. Why manage type 2 diabetes with pills when you can cure it with diet? Exactly. Why wouldn't you just cure it? Because all the stupid patients go, it's under control, they don't want to talk about it, they're going to the doctor, it's under control, they know what they're doing. No, they're stupid idiots. Just fix your diet and cure the thing. It's the same diet. It's a species-specific diet for optimal health and all your other organ systems. So why not fix diabetes while you fix everything else simultaneously as best you can? Okay, French fried potatoes are a high-fat food and can cause problems like other high-fat foods. However, regular potatoes by themselves are great, baked or boiled. They do not cause diabetes. In fact, it's good to feed potatoes to diabetics. Potatoes have only 1% of their calories from fat. Okay, let's see if we can get this set up here. Low-carb diets are a bad idea. The 4 long-term studies on low-carb diets show that low-carb diets increase mortality. The people die sooner. There's all these sort of loudmouth, ignoramus, low-carb, paleo, keto, carnivore idiots on the internet. They're very sort of loud and aggressive. The high-fat, high-meat diet, it makes people kind of stupid and impulsive. It's very characteristic of their behavior. Plus, it's funny, they come to the vegan sides. We already know what a joke low-carb, keto, paleo diets are. I mean, it's for all the chumps. I want to thank you, low-carb, paleo, ketos, for donating your bodies to science. I know lots of residents that will enjoy practicing their operations on you. Okay, let's continue here. With type 2, this is Dr. Mcdougall talking. With type 2 diabetes, the oral drugs are dangerous. They can lower blood sugar, but at a price. They tend to cause increased death rate in type 2 diabetics. FDA approval for drugs is based on their ability to lower blood glucose. It is not based on mortality or other relevant outcomes. Black women have increased risk of type 2 diabetes because they tend to eat a poor diet. Diabetes medications can create a vicious cycle. The medications cause weight gain, and then the weight gain can worsen the diabetes. If a patient improves their diet, eats a starch-based vegan diet with no oils, they typically lose weight and cure their type 2 diabetes and make a lot of other problems improved. Some of the newer diabetic drugs can lower cardiovascular risk factors a little, but they can cause an increase in problem. Sulfonylurea drugs were used as herbicides. That's not good. I wonder what they're going to do to your gut flora. Okay, Mcdougall continues. Intensive medical management of type 2 diabetes is harmful. When type 2 diabetes is overtreated, the outcomes are worse. Hypoglycemia is dangerous. All 6 studies on aggressive, intensive management of blood glucose levels in diabetics show that this kills more patients. Yeah, if they're hypoglycemic, they could pass out while they're driving, have a car crash, they could faint, they could have all kinds of problems. Intensive management, somebody could think they're drunk driving. Intensive management of type 1 diabetes is harmful. It may increase the risk of coronary artery disease, more weight gain, higher blood pressure, and higher levels of triglycerides and total cholesterol, LDL cholesterol, apolipoprotein B. Okay, so intensive management for type 2 diabetics is a very bad idea. Okay, just another study. All of them show these bad outcomes. Okay, bariatric surgery can cure obesity, but it comes at a high price. Bariatric surgery is surgically induced malabsorption and sickness. Okay, bariatric surgery can cure type 2 diabetes. Any type of weight loss can cure type 2 diabetes. And I've known some people. And so I had some friends. They said, oh, we got somebody who's considering bariatric surgery. Would you be willing to talk to them? I'm like, yeah, sure. But they were too embarrassed to talk to me. So they went and had surgery, did well for a year, lost 70 pounds, and then had a massive complication. It was gastric perforation, needed emergency surgery for that. Big disaster. I've had other people, their kid has a weight problem, goes for bariatric surgery, and then developed a neuropathy from a malabsorption syndrome. It's not a party. You want somebody making a big surgery into your abdomen, removing half your stomach or something. All you got to do is eat a low-fat vegan diet. Why would you want to do that? It's stupid. Okay, plant-based diet can be very helpful for treating painful diabetic neuropathy. The study by Dr. Neil Bernard showed that the plant-based diet is a helpful way to treat diabetes. The patients were randomized a low-fat plant-based diet for 20 weeks, and they showed a significant reduction in diabetic neuropathy pain. Yeah, because then when you fix the diet, you fix the diabetes, so you don't get a microvasculopathy from diabetes. You don't get all those secondary pathways of advanced glycation end products, and a whole bunch of other toxic pathways. And the microvasculopathy is going to make everything ischemic. You give everything better blood supply, everything has a better chance to heal. Okay, next paper on it, regression of diabetic neuropathy with a total vegetarian diet. Many patients had complete relief of their systemic distal polyneuropathy in 17 out of 21 patients in just a little over 2 weeks. With diabetic neuropathy, the number one goal is just cure the type 2 diabetes. Numbness and tingling with diabetic neuropathy can be related to poor blood flow. Yeah, so low-fat vegan improves blood flow. A lot of doctors, by the way, think metformin is some type of great medicine. I've had doctors that are, fellowship trained tell me, oh, should I take metformin to increase longevity? I'm like, are you kidding me? Are you stupid? Metformin is a mitochondrial inhibitor. I would never intentionally take a mitochondrial inhibitor. Okay, reappraisal of metformin efficacy in type 2 diabetes. Here's some randomized controlled trials. And they showed that in one study, 31% had an increase in all-cause mortality on metformin, and another one, 64% increase in cardiovascular mortality. Great. I wouldn't want to take anything that's a mitochondrial inhibitor. It inhibits mitochondrial complex 1. I would stay away from that. Okay, type 2 diabetes is an autoimmune, this is type 1. Type 1 diabetes is an autoimmune disease related to dairy. Everybody should know that. Yeah, and T. Colin Campbell has written a lot about that. So has Dr. Mcdougall. It's sort of like, dairy is like one of the most, if not the most overrated food. And they also think that dairy is strongly related to multiple sclerosis and autoimmune disease and multiple sclerosis. Okay, this is from Dr. Mcdougall's Cure Your Diabetes with These Simple Changes and How to Cure Autoimmune Diseases at his Dr. Mcdougall's YouTube channel. Okay, and that's all I got for diabetes. I hope that was helpful. And we'll leave it at that.